Hello, Senator Stabenow. This is Nicole calling in regards to the follow-up postcard that I sent you about the Affordable Care Act and the revisions they want to make about the mental health policy specifically. Yes, I am a social work student at the Central Michigan University. Yeah, so I am concerned about the revisions that may be made regarding to the Affordable Care Act, and I know there is some discussion about reducing or cutting mental health coverage, and that would include substance abuse coverage as well. I think that could be potentially dangerous for the people who use those services, especially those who use it frequently. I'm sure you are aware of the articles that are floating around the internet stating how the GOP plans to remove basic mental health and addiction services to the Affordable Care Act, and that starts in 2020, I believe. Yes, I would like to be included in any postings you may make regarding this topic. I look forward to hearing from you, and I hope that these revisions do not entirely eliminate these services. Thank you. I chose to do this topic after reading an article from the Washington Post. The article stated that the Republicans wanted to remove basic mental health and addiction services starting in the year 2020 for the states that expanded Medicaid, and that includes Michigan. The article went on to discuss how it would be a major setback for the opiate epidemic that is currently going on in our country. 1.3 million people receive treatment for mental health disorders and substance abuse disorders under the Medicaid expansion. This means that all these people would not have to pay for these people would have to pay for these services completely instead of having insurance to rely on to cover most of it, if not covering all of it. The Republicans believe that these cuts will give the states more flexibility in coverage decisions. So basically what I'm asking from Senator Stabenow is to prioritize this issue. I've stated my concerns on the issue, and now I would really like her to negotiate with me and state her position on the topic. I want to know what else can be done to make sure that these services do not get removed completely. I understand that there are limitations to this issue and not every state can provide these services, but they should still be one of their top priorities. My initial position is that we need to keep providing these services to those who need it. Without them, their disorders will only get worse, and this can lead to problems in not only their lives, but in other lives as well, and that'll also affect our society. My fallback position is that maybe if all services cannot be provided, that some of them still can be. This could mean like cutting or reducing a little bit of funding, but not completely removing the funding for them. That way that mental health and substance abuse would still be covered, it just may not be covered completely. The frame that I believe fits with this issue the most is that it will hurt the public and it will hurt future clients. By cutting these services, people who have mental health disorders or substance abuse disorders will not get access to the resources they need in order to improve their conditions. Most people are on Medicaid for a reason, and that reason being that they cannot afford health care to begin with. As someone who is also on Medicaid, this would affect me as well since I have used mental health services before. I think the fear appeal is good to put into perspective here because things will not go smoothly if this is removed from the Affordable Care Act. By passing this revision to the ACA, millions of people will be affected. The article discussed that there were 33,000 deaths in 2015, and those were caused by opiate overdoses, and that exceeded homicides by guns and motor vehicle accidents. So that definitely shows that there is a substance abuse epidemic going on in our country. If the people who have addictions cannot get access to treatment, that number will be even higher. So that is something that I honestly don't think society will be able to handle or come back from. So that's why I think these services are really important. There should be a fear for those who will be affected by this revision because it will change people's lives. I have some knowledge as a quality in this area since I grew up with a mother and her family members having mental illnesses, so I kind of have some background knowledge in that. I saw how it affected our family when we couldn't afford her medication through certain periods until we found out about a certain program that could provide affordable medication to her. So as far as my expertise goes, it's based on personal experience rather than schooling, but I will be getting my master's in social work, so that'll give me even more knowledge on the topic through schooling, so I think that would make a good quality for me too. I should also note that I believe I am a trustworthy person, and I think Senator Stabenow would pick up on that rather quickly. Overall, I think that Senator Stabenow should consider the revision very carefully and really look at the different perspectives to it. I think that the revision would be very harmful for the public and future clients, and I think that it should be taken seriously. Thank you for listening to my follow-up and my concerns regarding this issue.